Hello everyone, welcome to today's lesson. Today we are going to see about laryngospasm. Under this lesson, we are going to see the definition of laryngospasm, the risk factors and causes of laryngospasm, and finally we are going to see about the mechanisms of laryngospasm. So when you are coming across to the first one, the definition of laryngospasm, Laryngosspasm is a forceful, involuntary spasm of the laryngeal musculature caused by stimulation of the superior laryngeal nerve, which is a continuation of the tenth cranial nerve, which is vagus nerve. This leads to the reflex closure of the vocal cord and common during induction and emergence from anesthesia and most common in infants from 1 to 3 months old. Saying this laryngospasm can be complete laryngospasm and incomplete laryngospasm. When we see this incomplete laryngospasm, it's defined as an incomplete apposition of the vocal cord with a residual small gap between the cords posterior that permits a persistent inspiratory stridor, limited movement of the reservoir bag, and the progressive increase in respiratory effort. When we come to the complete laryngospasm, it is the complete closure of the vocal cord. And the net effect of this complete laryngospasm results as a complete cessation of air movement and noisy respiration, an absence of movement of the reservoir bag, and an absent capnography. When we come to the risk factors can be patient-related factors. They may be surgical-related factors and anesthesia-related factors. When we come to the patient-related factors, the first one that we got is age, which a reverse correlation with age. That means young children are at greater risk for laryngospasm. The other is chronic smokers as well. One risk factors the patients who has airway anomaly, the patients who develop recent upper respiratory tract infection, especially which stay less than 2 weeks, and the patients who has a coexisting disease of asthma, which is estimated approximately 10 times increased in risk if active asthma is present in a specific patient. The other is surgical related factors, thyroid surgery due to superior laryngeal nerve or hypocalcemia secondary to accidental parathyroid gland excision, and esophageal surgery thought to be due to the stimulation of distal afferent esophageal nerve. And all the surgeries which undergo on the airway, they are risk factors for the patient to suffer laryngospasm. The next one is anesthesia related factors, the inadequate depth of anesthesia. The anesthesia doesn't supposed to be light anesthesia, it's supposed to be deep unless the patient will develop laryngospasm. The other is airway device like tracheal tube and is common in LMA. Volatile anesthetic agent like desflurane and isoflurane. The safest from inhalation anesthetic agent or volatile anesthetic agents are halothane or sevoflurane. The other is inexperienced anesthetists are the risk factors. Then let's come to see the mechanisms of laryngospasm. How does this occur, or the pathophysiology of laryngospasm? As we have discussed so far, laryngospasm is an uncontrolled or involuntary muscular contraction of the vocal cord and ligaments. The vagus nerve has actually proven a predominant cause of nervous mediation. The superior laryngeal and pharyngeal branch of cranial nerve 10 and the recurrent laryngeal compose that the vagus nerve. So the mechanism deeply first there is a stimulus which stimulates the vocal cord, especially the superior laryngeal nerve. Then there is a depolarization of the superior laryngeal nerve, which result in the involuntary and forceful contraction of the laryngeal muscle, and this result in contraction of the laryngeal muscle, result in total vocal cord adduction, which results finally the complete airway obstruction in impaired ventilation, which we call it laryngospasm. So this is for today. Thank you everyone for your attention. If you have any question, please comment me on the comment section. Thank you very much.